Hello and welcome to another episode of Meet the Practitioners. As you know, this is a special segment dedicated to discussing issues related to pregnancy, childbirth, motherhood, as well as infants. And it is brought to you by the Association of African Universities in collaboration with Center for Pregnancy and Childbirth Education, that is CPACE. And my name is Isabella Tetteh. Of course, we are in the month of October, which is dedicated to celebrating as well as creating awareness on breast cancer. And this episode, our discussion is in line with the theme proposed by World Health Organization, which is every story is unique and every journey matters. And if every journey matters, has it come across to you or has it come to your mind that a pregnant woman can also be diagnosed of breast cancer? No, I know you haven't thought of that. And so on this episode, we are discussing breast cancer during pregnancy. I know you wouldn't want to miss this discussion, as well as who we'll be doing this with. We'll go for a quick break. When we come back, I'll introduce our guest to you and start the discussion. Please stay tuned. You're welcome back from the break, and thank you for sticking with us. This is Meet the Practitioners on HealthAfrik, and if you just joined, you can follow the discussions on our social media handles at Association of African Universities, both on YouTube and then Facebook. Today, we are discussing breast cancer during pregnancy to commemorate the Breast Cancer Awareness Month, which is October, and we are happy to have here with us Dr. Eric Tetteh, an OBGYN from Korle Bu Teaching Hospital here in Accra, Ghana. He's been with us before, and today is the second time. Hello, Doc.
Hello, Isabella.
Thank you for coming to Meet the Practitioners again.
Thank you.
Right. So today we are celebrating. We are in the month of breast cancer awareness, and today we want to talk about breast cancer during pregnancy. Something that has not really come across a lot of people. We've never thought of pregnant women also having breast cancer. So today, it's very quiet. I think it's crucial we have this discussion. Now, my first question will be, how common is this when we talk about breast cancer during pregnancy? How common is it? And also, how important is this discussion?
All right. Thank you, Isabella. And I would like to welcome our viewers and thank them for joining us. Breast cancer, as we know, is common in women, although it affects men. Yeah. And for women, normally we see it's women who have 50 years and above. But when it comes to pregnancy, pregnancy happens in women who are a bit younger. Yeah. But I must say that breast cancer complicates about, 1 in about 3,000 pregnancies. Yeah, so it means that, yes, it can happen, but it's not really that common. Okay. It's a bit rare. In my practice, we hardly come, across women who come in with, advanced breast cancer and all that. But once in a while, we do have them. Okay. So I must say it's something that once we're in the month of October and talking about breast cancer, we should raise the awareness as well, so that women who are pregnant also know and get checked. Yes. Okay.
And just like you made me, it's not common. So of course, our mind really wouldn't be around it, thinking about it, or even considering that. So let's look at the signs and symptoms. When a woman is pregnant, or when you are pregnant, you have it comes with its own symptoms and signs, and some are around the breast, which to me, I think it's quite similar to that of breast cancer. So share with us some of these signs and the symptoms, and also how to distinguish between it being pregnancy or breast cancer. Yeah.
Okay, Isabella, that's good. But before I come there, it's one thing I have to mention, that, the prognosis. So when we say the 5-year survival for women who are younger, okay, and have breast cancer, especially for our women who are pregnant, okay, we say that about 85% will have 5-year survival rates being high. So it means that it's good, though it's one of the things that we don't want them to have. But if you are younger and have breast cancer, the prognosis, 5-year survival is good. So having said that, the symptoms, yes, pregnancy symptoms, breast cancer symptoms seem to be almost the same. Yeah. Because when you are pregnant, yes, you have your breast getting bigger in size, changing the contour. Same you have when a woman notices that, she's getting breast cancer. You have the breast being painful or tender. You have, sometimes the breast, having, some colorations or discoloration, and then again you'd have some discharge, though in pregnancy it may be milky discharge. And then the last thing is about pain or so one of the things you would distinguish between, you know, breast cancer symptom and pregnancy is that for pregnancy you wouldn't necessarily have them having bloody discharge, nipple discharge. So that will go, if you're a woman who is pregnant and you see that, that would go more for breast cancer. So those are the things. So because of that, the pregnancy symptoms sometimes would mask early disease breast cancer. So it tends to delay for women who have breast cancer and they are pregnant. It tends to delay the diagnosis. So that's a bit challenging. Yes.
Now, is there any other other signs to distinguish whether it is early and it is pregnancy or
yes? So one other thing is that so the dimpling of the breast, which we sometimes it looks like the skin of an orange or a peel of an orange. You know, for pregnancy, yes, sometimes you have swelling as well, but for breast cancer that will be marked. So that one then it will raise your your suspicion. And then the other thing is that the inward movement of the nipple. You know, a woman is pregnant, you want the nipple to come out because you are thinking of breastfeeding. But rather if you have it moving inward, then it will suggest to you. Or sometimes, yes, there might be lumpiness of the breast in pregnancy. But for breast cancer, you see that this lumpiness or this thickening would persist, especially to the the armpit area and all that. So that again will raise your suspicion there. You want to look further to rule out cancer.
Right. So just like you made mention, it is not common. So the question is then, how then do you detect? How are you able to diagnose or even detect that this person, though pregnant, also has breast cancer?
So one of the ways, for us as obstetricians, when a woman comes during the first trimester, we take history. So the history helps us. So if a woman comes to you and then aside all the symptoms we've talked about, she complains about them, but then you go into the family history, you see that, oh, this woman tells you that the mother or the auntie or the other siblings have complained or have had cause to say that they have breast cancer, then you want to take a look again. And again, the other, hereditary factors, that you can pick up, like the breast cancer antigen. If it's common in that family, that the risk of that woman getting breast cancer is high. And so those are some of the things that, again, will raise your suspicion with the history. Then we also have the opportunity to examine. Again, when they come in as part of our assessment, we do a thorough body examination, including the breast. So during your time of examination, if there's any lump or anything that is suspicious, once the woman, raises your attention or draws your attention, you're able to examine and then you pick up, these lumps or the other things we've talked about, like the dimpling, the puckering of the breast and all that. So the examination would help us make a diagnosis. And the last thing is that when, again, as you said, some of the symptoms of pregnancy may mimic that of breast cancer. If you are not sure, there are other tests that you can do. So investigations, So you can do a scan. A scan is safe in pregnancy. It doesn't expose the babies to anything. So when you scan, it can help you. Some people can do a scan, and sometimes you can take some bit of whatever lump it is to take, to the, pathologist for them to look at it for you. Yes. And then the other tests like mammogram. But those ones are X-ray. So those ones, yes, you would have to protect the baby. Shield the
because
baby
when you said the scan, I was like, okay, how about the baby? These things sometimes we don't advise when you are pregnant. But thank you for clarifying that to us. Now, someone listening to us today will be maybe pregnant, will be like, okay, now should me being pregnant and being diagnosed of breast cancer, does it mean I'm going to terminate my baby, or can we actually carry it to 9 months?
So Isabella, thank you. That's a good question. So once we make the diagnosis, so if it's your first time we are picking breast cancer in pregnancy, again, we have to, with the help of other, investigating, techniques or tests, able to stage the disease. So if it's early disease, so maybe stage 0, 1, or 2, that year sometimes we can allow you okay, whilst we follow you up. If there's any intervention, I'm sure we'll talk about the interventions or the treatment. And those ones are allowed in pregnancy. Yes, you can carry the pregnancy to term or to 9 months, as it were. Unless maybe we pick it up and then it's very advanced stage. So stage 3, stage 4. Those ones, yes, you would, want to do other treatment modalities. That may not be safe for the baby. But then again, always the decision has to be shared. Discuss with the woman, and then based on her preference, that's what we go with.
Okay. Now, I would want to know the stages, because if you are saying stage 0 to 2
to 0, 1, 2, 3, 4. Yes.
Then 3 to 4 is quite extensive, and that you would like to terminate the child. What's the difference? What let's know the stages briefly.
So stage 0 means that it's just maybe you've seen the lesion or whatever in the breast. Okay. So normally it's one breast. And then it's just in the breast. It hasn't gone out. So in the breast we have certain, tissue. So it may be in the duct, or it's in the lobule, or it's in the hand. So once it's within that, the duct, it hasn't gone to other parts of even the breast, the hand. So that is just stage 0 or 1. Okay. Stage 2 means that yes, it has moved to other structures, around the duct or hand, and even gone to the lymph nodes. But then again, it's within the breast. It hasn't gone out. Stage 3, stage 4 means that it has left.
Spread.
Yes, gone to other parts. Stage 4 means gone to the liver, the brain, the bone. So for those ones, it's not just within the breast.
And that is going to affect the baby, right? That's why you have to
yes, so those ones, the treatment modalities may affect the baby. So then that one,
you have to terminate.
You have to again discuss with the woman. Because sometimes the woman may say, yes, these are my options, of treatment, but then again, I want to carry on the pregnancy. So it has to be her choice. Yes. But the teaching or the advice we always give is that you want a healthy woman. Okay, so you don't compromise the woman for the baby, so that the baby, yes, you always want the woman to be alive. So whichever it is, it depends on
the mother.
You want to save the life of the mother.
All right. Talking about treatment, so let's talk about the intervention. So what are the available treatments, and then what clinical factors do you consider before advising or prescribing a treatment to a patient? Now let's consider the stages as well, just like you mentioned.
Yes, so I'm sure, sometimes the dilemma, or sometimes the fear of women is, when you mention breast cancer, they think that, okay, my breast, I'm going to lose my breast. So people are a bit hesitant. But you see, when you go early, so because early detection, as I said, sometimes the cancer might be just in a small part of the breast that we may not even have to remove the whole breast. And for that one, we call them lumpectomies, okay, or surgical segmental, mastectomy. So it means that we don't remove the whole breast. We just remove a segment, or just that part where the lump is, it hasn't spread. So for stage 1 disease, you can do that. Okay. For if it's gone beyond and gone to the lymph nodes, and then that one, yes, sometimes you might have to do the modified radical mastectomy. So then you have to remove the whole breast and take it for examination to know the type of tumor it is, to know the grade. If you say the grade, how, aggressive, or if not aggressive, the tumor is, because all those things would inform what kind of treatment you would require. Okay. Yeah. So that's the surgical modalities. Then apart from the surgeries where we remove your breast, again, you can have some that will give you hormonal therapy. So based on the type of cancer, again, if there are certain receptors, that are on the tissues that we're taking, yes, if it would, respond to hormonal treatment, we can give you hormonal treatment. And then we talk about drugs, chemotherapy. So chemotherapy, yes, we give you. And sometimes chemotherapy is either given before the surgery, what we call the neoadjuvant, or after the surgery. So if you are not able to remove the whole thing, and you think that there's still some residual, then you have to undergo chemotherapy. And the last form is that you have to have radiotherapy. So we subject you to, radiotherapy rays to try to deal with whatever is left after the surgery.
Wow.
So these are some of the things, that treatment modalities that you can have.
It is quite intense, and that is why we always say that early detection is very, very important and can save life. Doc, we'll go for a quick break. When we come back, we'll continue with the discussion. Please stay with us. We'll be back.
Explore a whole new world of exciting visuals with AAU TV. Get ready for a mix of interesting talk shows, interviews, discovery documentaries, and news on AAU TV. It's not just about watching TV, it's about experiencing something special. AAU TV reaches over 25 countries in Africa, bringing you a blend of knowledge and fun. Learn about different cultures as you enjoy the shows. If you have events or want to showcase your business, we've got you covered. Watch AAU TV free-to-air channel on satellite. Connect with us on Facebook, Instagram, and X, formerly known as Twitter, at AAU TV. Reach out on call or WhatsApp us at +233 26 629 6601 or +233 20 399 5210. AAU TV, the voice of higher education in Africa.
You're welcome back from the break, and this is Meet the Practitioners on HealthAfrik. And today we are discussing breast cancer during pregnancy with Dr. Eric Tetteh, an OBGYN from Korle Bu Teaching Hospital here in Accra, Ghana. Hello, Doc.
Yeah,
Thank
hello,
you for
Isabella.
sticking with us.
Thank you.
So before we went for break, we were talking about treatment. I would like us to delve more into this treatment, especially related to the development of the child. But I forgot to ask, before we come to that, what are some of the risk factors when it comes to developing breast cancer during pregnancy?
Okay, so thank you. So the risk factors, yes. So from I talked about age. Breast cancer tends to be more in women who are 50 years and above. For us, reproductive age, normally 15 to 49. So as I said, that for us, unless women who are delaying childbirth now, because of school, one reason or the other, women are delaying. So we are getting to ages we call advanced maternal age. So for those women, then issue of breast cancer may be coming up, because some may be having it at 40, about 40. And those are the ages where you can have breast cancer. So age is one of the risk factors. And then we talk about family history. So if you have a mother, a sibling, a cousin who has breast cancer, it means that your risk of getting breast cancer is high. The other thing is about, a woman who has early menarche. Okay, early menarche means that you started your menses quite early, and then you have your menopause quite late, or late menopause. So it means that the period with which, the, fertility hormones, which we talk about, estrogen, progesterone, tend to, act on that woman is quite long. That is a risk factor. Because we've seen that women who are under hormone replacement therapy have a higher risk of developing breast cancer. So you don't want to get older as a woman. You don't want to have all the menopausal symptoms. Be careful. If you are taking those hormonal pills, you are at risk of getting, breast cancer. Again, we talk about hereditary factors. So a woman, you have this gene we call the breast cancer antigen 1 and 2. So if it's in your family, there's the higher risk of you getting. And then obesity is one of the things that predisposes women. So you are pregnant, or the weight you started with is quite high. So sometimes we tell our women to, those above 90, we want them to get pregnant below 90. So obesity has been found as one of the risk factors for developing breast cancer. So those are some of the risk factors.
Let's look at the gene factor. So is it that one? Is it when I come and I tell you, okay, my mom or maybe my grandmother actually had breast cancer, doesn't mean I also have that gene in me, or there's a test?
Yes, so first relation or first relatives, yes. So there's a test we do. So that's the breast cancer antigen we talk. So we'll try and check whether, because it's your relation, it's possible that you may also have that behind. So it's rather the mutation of the gene, not the gene behind. And that goes to mutation that predisposes you to get a breast cancer. So that's what I'll say about.
Thank you for clarifying that. Now back to the treatment. You mentioned quite a number of them: the chemotherapy, the X-rays, and among others. Now let's look at each stages, and then the advantages and then disadvantages. with every treatment, it comes with a disadvantage. And here we are looking at the baby being developed in the womb of a mother. So let's look at its advantages and disadvantages.
Yeah, so I would say that some modalities of treatment we can administer. You know, pregnancy, we have 3 stages. The first trimester, second trimester, and third trimester. Yes. So, and one thing I didn't mention is that for treatment and breast cancer care in pregnancy, you need a multidisciplinary team. Okay. So an MDT. So you need your obstetrician, you need your surgeons, you need your anesthesiologist, you need your pediatrician or neonatologist. Okay. So it's a team. So once you diagnose and you want to give treatment, the team would have to agree. So depending on which trimester it is and the modalities, that will be okay for the mother. It's a balancing act, both for the mother and for the baby. Okay, so say there are certain treatments that you can administer first trimester. That will be okay for the mother and for the baby. Say surgery, like lumpectomy, is very early stage. Okay, you want to remove it. You've discussed with her, the woman says so. So the challenge is that if you put this woman under anesthesia, would it affect the baby? Will you be able to do the surgery to remove? The answer is yes. Anesthesia doesn't really affect. But as I said, you need a team who would assess. So for those ones, surgery, basically, you can do it regardless of the gestation in which of the pregnancy the woman is. You can do to remove that lump or the breast or But for chemotherapy and radiotherapy, those ones, because of the medications we use are harmful to the baby, especially during the period when the baby is growing at a faster rate in the first trimester. So for chemotherapy, the answer is no when they're in the first trimester, because then it will affect the baby. It's teratogenic. So for those ones, yes, we don't want to use them. Okay, same for radiotherapy. So again, so you would consider chemotherapy when you've gone past the first trimester, maybe into the second or the third. And those ones, I said, the benefits would have to outweigh, the risk. So it's a balancing, again, MDT discussion, and then you choose the medications you are giving, so that, because some of them may affect, and the side effects too. It's a bit challenging for the pregnancy. Pregnancy always comes with vomiting, weakness, and some of these medications would worsen, would just exacerbate the vomiting and all that. So you have to look at all that. And then before you start. So
Doc, now let's look at, you made mention some of the treatment is taking away the breast for was a scanning to determine, or experiment to determine what type of cancer it is, among others. Now we know for sure that if maybe the mother is allowed to carry the baby till 9 months and even deliver, after delivering the baby is feeding the child, which is breastfeeding. Now here lies the case, you are diagnosed with breast cancer. Now, what are some of the the impacts? Like, I want to know, how is a mother diagnosed with a baby going to with the breast cancer going to breastfeed the child?
Yes, so Isabel, before I come there, we have to look at partner support. Okay, going through the treatment, even for a non-pregnant woman, we know how challenging it is. Because some of these medications, and even the thoughts, the emotions, pregnancy is an emotional state. So, and for you to say that, okay, I'm going to remove part of your breast or all your breast, it's difficult for the woman. So yes, we can talk about the treatment available, but you need partner support and close relation support for the woman to go through. I know for the non-pregnant women, they have support groups that help the women. Sometimes it's not just a one-off. Sometimes they have to process this. Some are in denial, and there are groups, support groups that help them, to go through. And they see survivors, okay? It's something that helps them a lot. You see that, oh, this woman had it. She's gone through. I can also go through. That alone is very important. Same for the pregnant woman. As I said, pregnancy, a lot of emotions, swinging of moods and all that. So to have to process this information and then have to go through the treatment, you need support of some kind. Okay. So back to your question. Yes, about the
the breastfeeding.
Breastfeeding. So luckily for us, most times, early, even if it's early disease, you tend to remove one breast. Hardly do you have both breasts involved that you have to remove, or God is merciful like that. So sometimes you know, if the disease is located or localized in one breast, you have the other breast. Okay. So if the other breast is not affected, and then you remove one breast, say stage 1 disease, early disease, yes, they can breastfeed. Okay. But then again, you have to follow the woman up. Okay. You have to follow it up, you know, try to do the other things, the other tests, you know, scan the breast, do the other investigations to make sure that there's not recurrence or of the in that thing. So you can breastfeed. Now for those ones that you advance, so sometimes you've talked to the woman, okay, maybe you've delayed a bit, she's giving birth. Now sometimes we delay the treatment, and after birth we want to really go in, remove the breast and give them chemotherapy or radiotherapy. Then the question comes in, so for those women, how are they able to breastfeed? Because the baby, we are all pushing for exclusive breastfeeding, and now the breast is going to go away. Or certain chemotherapeutic agents that you're going to give, even if it's one breast, may not be good for the fetus or the baby that is born. So then what do you do? Okay. But thankfully, yes, for those ones, yes, again, you discuss with the woman, okay, what are her preferences. If she decides that, okay, fine, I'm not going to breastfeed because of my health, because of where the tumor has gotten to. So please, you remove it. I'm going to receive chemotherapy, radiotherapy. Then there's the alternative of using formula feeding. Okay, so that the baby is also not left out. Then yes.
You know, when you talked about, thankfully, God being so merciful, it mostly affects one, which one breast will be taken off. That means you have one. It came to mind. There's this myth that I hear especially when my mom was pregnant, they said one breast is water and then the other breast is milk. Food. It's actually it's milk, but it's food. So when you turn this side and you breastfeed the child, and you have to turn the other side and then give them. I mean, now maybe someone believes this myth, and now one breast is gone. So to her, she thinks the food part is gone and left with water. Maybe you can clarify that for us.
Oh no, it's for breast milk, you know, majority like 70-80% is water. And then so it's not true that one is it's all contains
so they are
milk.
the same.
They are the same. They are the same. But I only argue with women who say that, okay, my baby tends to prefer this to the other. Yeah, it happens, but they are the same. And it's all good for the baby.
All right. And also to touch on the support, you've made mention of the husband supporting, family supporting, but when it comes to the clinical aspect, the hospitals, do you have any support available, maybe counseling or any other support for the woman?
Oh yes, we do have. I mean, it's, as I said, the breaking of the news itself is challenging for the woman. So that's why we have this multidisciplinary team. Okay, so there's the breast cancer survivors, there's those who are trained, they are specialized nurses who are trained, okay, to really help you go through. So there's the support. There's a clinical psychologist who are sometimes, you know, engaged to help and all that. So in the hospital setting, yes, there is, okay, so that it will help you emotionally to be able to, you know, overcome. And because it's all good when you are in a good state of mind, for you to undergo the treatment and all that, you need that support. So for us, yes, we have.
Very true. And of course, the support of husbands and families, as Doc made mention, it is very, very important. Already being pregnant has its own wahala, and then being diagnosed of breast cancer. So we need double, triple of that support. Now, before we wrap up, my last, what will be, we are in the month of October, which is Breast Cancer Awareness Month. What will be your last words to our audience, our viewers watching us today?
Yeah, so thank you, Zeba. So my last words, first to the patients, and then I'll come to the health workers. So to the patients, yes, let's take advantage. You know, now the advocacy is all there, the campaign is all there. We want our women to survive, okay? We want them to live long, most especially if you are pregnant after pregnancy and you lose your life just because of pregnancy. So early detection. So let's go make use of the campaigns, you know, that are going around, you know, examining people's breast. And most of the times when you are pregnant, it's even easier because when you go and you have any, you know, misgivings or anything that is in your breast that you don't understand, it will be checked for you. So that's for our patients. So let's take advantage because early detection, early treatment, you survive. Now for our health workers, okay, I would say that yes, especially for our midwives who most of the time come into contact with our pregnant women. When they come, let's take our time. Okay, let's take the history. As we said, pregnancy can mask the effect of breast cancer. So if you are not thorough enough, you may miss it, you know, and we know when we miss it, sometimes we detect it late and, you know, it might not be good. So let's take advantage. Let's talk to the women. Let's ask them about the symptoms that we've discussed. And again, let's take our time to examine the breast. Okay? Taking your time to examine the breast, even if you are looking at whether the woman can breastfeed, it's an advantage or it's an opportunity for you to be able to pick up a lump or an unusual breast, so you can advise her to do certain other further tests that can lead us to detect the breast cancer. So let's all help, to break breast cancer down.
All right.
So that our women survive.
Okay.
Thank you.
Thank you very much, Dr. Tetteh. Thank you so much for the insight and for educating us today on breast cancer during pregnancy. We really appreciate your insight, and we hope to have you again. This is the second time. We are going to have you again and again and again and again.
Thank you.
Thank you very much.
You.
And this brings us to the end of today's discussion, where we talked about breast cancer during pregnancy. Like I mentioned again, early detection actually saves lives. And today we've got to know that women who are pregnant actually have that advantage, because they are most often examined at the breast to know whether they can breastfeed. And here it can be detected they have breast cancer. And if you are diagnosed of having breast cancer, please listen to your doctors. I mean, you have a whole team to be there supporting you, so listen to the doctors and always go for screening. My name is Isabella Tetteh, and it's been nice having you joining us on this discussion. Hope to see you again. Have a good day.